like we have been saying from the beginning of the month, that it is the month of October. It's Pink October, and so we are pushing the awareness of breast cancer. If you not just for women, okay? I was going to say if you're a woman, but I almost left the men out of it. But men, you are part of it as well. Men do get breast cancer. It is not only women. Men do too. So please, both men and women, we all have to go get checked for breast cancer. But today we are going to talk about the benefits of preventive strategies, what we can do to prevent us having breast cancer. What are some of the benefits of them? I know that there are quite a number of preventive measures that you are aware of, but at the end of the day, how would it benefit us? That is the topic for discussion today during Good Living segment. And so I want you to, as usual, get interactive with us. If you have any questions at all in relation to breast cancer, if maybe you're feeling quite uneasy about certain things when it comes to your breast, you don't really understand, the right person is here to answer all the questions for you. So make sure that you start sending in your questions. My guest is Stefana, or she says I should call her Fana. Fana Boateng, public health practitioner, women's health educator, executive director, Glitz Medical Center. Good morning.
Good morning.
How are you?
Very well, thank you. Yourself?
I'm great, and I'm going to repeat it. You're very beautiful.
So are you. Thank you.
And you're representing in pink.
Yes.
Yes.
It's Pink October.
It's Pink October. Yeah. Right. So I want you to introduce yourself to our guests.
Okay. So hello and good morning to everybody watching us. Just like you said,
yes.
I'm a public health practitioner and I'm a women's health educator. I serve as a executive director for Glitz Medical Center, a boutique healthcare facility that does preventive health as a whole huge umbrella. Okay. So we're here today to talk about breast cancer, I'm sure.
Yes.
And I'm sure our listeners will have a good educative sector, and then they'll be able to pick up a few things going forward on breast cancer.
So there have been quite a number of talks from the beginning of the month in relation to breast cancer, and I quite remember that I had a friend, a male friend, whom when he was young, he felt some things in his breast. A male.
Yes.
He felt some things in his breast, and then he would feel uncomfortable. But after he grew, I think he turned about 26 years. He decided to get surgery to take whatever. They said it was lumps that were in there. And the question I was asking myself, well, could that be hormonal? What at all could have contributed a guy having lumps in his breasts? And then now it's like when you look at him, when you look at his chest, it's sort of like that's how it looks like. But could a situation like that lead to breast cancer in a man?
Okay, I think it will be most educative if we have the etiology of the breast and breast cancer, so that we have the foundation to be able to build on. So breast cancer in general is a disease condition where the cells of the breast grow abnormally out of control. That is basically breast cancer. Okay. Now, the part or the type of breast cancer a person has is dependent on the cell of the breast which has become cancerous. Okay. There are three main cells or parts of the breast. The ducts, which are the milk producing parts. The lobules, that transports the milk from the duct to the nipples. Okay. And then the connective tissues that holds everything together. Most breast cancers do start from either the ducts or the lobules, and then they can spread to any other part of the body. Now, every human being, be it male or female, do have this component. This is basic anatomy of the breast. But the female hormones is what gives us that enlargement and that exposure we get with our breast than the male. Okay, they have testosterone, we have a lot of estrogen, and so that's what brings about the difference. So basically the anatomical composition of the breast is spread across. That's why it's possible for a male to have breast cancer, and then a woman can have breast cancer as well. Now, preventive strategies. The discussion was the benefits of preventive strategies. In fact, in any disease management, the underlying root to say 80% prevents diseases is preventive strategy. Okay, the whole management of every disease is purely preventive, from primary to secondary to tertiary. Even taking medication getting treatment, getting surgery is even preventive, but it is the highest level of prevention, what we call tertiary prevention. Okay. So when I scale down into the real prevention of the disease, you get what I'm talking about. Good. Okay, so now let's have a look at what causes breast cancer. The truth is, scientifically, empirically, there is no concrete cause of breast cancer. Science has not gotten there yet, but there are what we call predisposing factors, or what can make you vulnerable, okay, to the disease condition. And then we talk in number one, we can talk of age. The disease is prevalent in people 40 years and above. We can talk of family history, people who've got people in their families way back, grandmother, auntie. It means there's some traces somewhere. And we can't say for sure that automatically because your grandmother had breast cancer, you're also going to have it. But it is a case of caution you should have at the back of your mind. Okay. The third thing is,
you know, before you continue, let's talk about, or let's look at the probability.
Yes.
So let's say your mother had breast cancer.
Yes. That will give you a higher percentage of probability than your grandmother, than your great-grandmother. So the closer the pathway, the huger the probability. This is basic logic will give you that predisposition, because you have more chromosomal effects from your mother, possibly more than your grandmother. You understand? Okay. Now we are looking at lifestyle issues like keeping a healthy weight. Okay, reducing exposure to toxins and other things that increases the predisposition to breast cancer, like smoking, like alcohol. And then women or people who have elongated exposure to the female hormone estrogen. Estrogen is produced both naturally and we can get it externally. So on the natural score, people who have menstruation too early, okay, if you had your menses at 10 years, it means cumulatively you'll be exposed to estrogen. Is the hormone that you know causes this whole menstrual cycle. So if you had your menses at 10 and you have your menopause at 45, that is a 35-year span of estrogen exposure. And then women who have menopause very late, if you had your menses at 15 and you are having your menopause at 55, that is a 40-year-old span of estrogen. So that is the natural pathway. People who have early menstruation or very late menopause, it is a very big risk factor, because estrogen promotes the breast cancer
cells. Like it feeds it.
Exactly. And then the artificial means. People who take estrogen-based contraception. My major concern is emergency contraceptive. Emergency contraceptive. The contraception you take 3 days post-sexual intercourse to prevent pregnancy. That is not a regular pattern of family planning. That cannot be your basic means of family planning your entire life. So if you think you are somebody who needs a form of contraception, then you should take a better or a more safer family planning option than taking emergency contraception. People are taking those pills twice a month, 3 times a month. Ideally, it should actually be taken once,
or even as much as they have sex.
Exactly. That should not be taken more than once in a menstrual cycle. It is an emergency pill. That's what I'm saying. It cannot be the main means of managing pregnancy or prevented pregnancy. And then people who use hormonal therapy to manage menopause. You know, menopausal symptoms come with hot flashes and all that. Now science have grown, and then you can manage those things. It is better to manage those things with vitamin therapies than hormonal therapies.
How is that done?
Yes, I'll give you details of that when we get to the preventive measure and how to go about it. You know, when you are taking hormonal stuff to balance your menopausal symptoms, it predisposes you to oxygen, to estrogen, sorry, not oxygen. Like I'm saying, if you use vitamin therapy, vitamin is nutrients, we get it from food, and science has evolved, so we are able to get vitamin in injections. So vitamin cocktail infusions, I don't know whether you've had a glance or a view at those banana bags that we hang. They are a very perfect move to manage menopause rather than using hormonal therapy. You get what I mean?
Get it.
Okay, so when you go to any facility that's hold preventive health like an umbrella, like we do at GLET, there are so many types of vitamin therapy infusions. We have what manages menopausal symptoms, we have what gives you glow and vitality, we have one for hangover and alcohol withdrawal, yes, and we have one for anti-aging. So if you are coming for the menopausal relief vitamin infusion, there are vitamins that promotes reduction in cell replication, abnormal cell replication, and that is basically the fundamental means to all the cancers, not just breast cancer. Okay, so all the cancers are cells replicating abnormally. So if there's any treatment pathway that has its aim at reducing the abnormal replication of cells, that is gold standard, if you ask me. Okay, and our vitamin therapy infusion also improves cell cohesiveness. When we say cell cohesiveness, the basic human body is made up of cells. So let's say we have 20 cells in this body. Each of the 20 cells have two components. Okay, the cohesiveness is what puts the cells in check, so that one particular cell does not become 3 and the other become 1.
Right.
So that keeps the production and the replication of the various cells in check. You make a meaning out of it.
Yes.
Fabulous.
Right.
So these are the predisposing factors to breast cancer. It will be very insightful for us to know the signs and symptoms of breast cancer. Now, the breast in itself has a natural shape and size. If you should be I mean, this is responsibility. You should know your breast. When you stand naked in a mirror, you should see this is not my usual breast. Yes. So when you see a change in the shape and size of the breast than you normally see, we are not saying automatically it's breast cancer, but it will make a lot of clinical sense for you to be inquisitive, seek attention for us to find whether there's something cooking or not. Number 2, you see this, the skin of the breast can be scaly and there can be dimpling. You see small holes. Okay, when you get goosebumps, you see the way your skin has some dimps, tiny dots in there. There can be those dimpling on the breast, and it is a case for you to seek attention. The whole breast can be red and sore. It is a case for you to seek attention. And then you could feel unusual lump and thickness. Okay, the breast in its natural form is not smooth muscle. It's lumpy.
It's lumpy.
I mean, when you feel it, you feel some elasticity and all of that. But this is unusual. Okay, quite not the routine thing, and it's usually felt in only one breast. Okay, the normal is bilateral because both are lumpy, both feel the same, both feel similar. I usually say most of the body parts that are two, they are not twins, they are sisters. There's a possibility you might not feel exact same thing here
as the other,
but it is quite close. Okay, but this new lump or thickening is quite unique, and it's mostly, more envisaged in one part than the other. So if you feel one and then you feel that this is quite weird, and you check the other and it's not prominent, exactly, it is a takeoff for you to seek attention. Now the nipples, they are supposed to be straight and erect. That is the normal. No matter how flat, how bad your breast is, your nipples are erect. But this time you could have them inverted, what that we call turned in. Yes, that is a cause for concern. A non-breastfeeding mother having milk when you squeeze the nipple, that is a case for concern. If you are not breastfeeding and you squeeze your nipple, you shouldn't have a discharge. There shouldn't be any milky discharge, whether milky, whether watery. There shouldn't be any discharge. Okay, so when you sense that, that is another cause for. And then you feel pain on your nipple is another cause. Sometimes it's not even just the breast and nipple, but the armpit area. You see, the breast connects, I told you about the connecting tissue that holds everything. It connects it to the surrounding areas. So the armpit is classified as part of the breast when it comes to this particular discussion. So you have to look out for these things. And when you are suspecting anything, it's better to go and have, there's nothing in there than to stay at home and then there's something burning. So all the symptoms that you've mentioned, I would say are all quite alarming if you had to get it, because there are stages of the breast cancer. So let's say at the beginning, or no, let me just put it as the discharge of the breast. So what stage would you clarify that as? Would you say that, if you have to see that in your breast, then it means that No, preventive health-wise, it doesn't really help so much for the patient. You raise unnecessary psychological stress. Okay. And today we're doing a lot more of preventive than curative. So the basic things, once you see it, you come along. I mean, we are different people. I can see discharge in my breast, and I could be in a certain stage, you will not be. So it might not make a lot of clinical argument for us to tag a certain stage to each signs and symptoms, but once you see it, then it's a means. Now, the preventive strategies, the main preventive strategies, like I said, we have 3: primary, secondary, tertiary. But we'll talk about primary and secondary today, because that is what will help us detect the disease early. We are not looking at end stage. End stage will not help us. So primary prevention are strategies or issues, stuff we put in place before health effects starts or health effects occur. Primary prevention are things we do even before the disease begins. That is the ultimate. That's what we are all looking out for. That is done by either vaccination or lifestyle changes or good dietary, I've
never heard of vaccination.
There is no vaccination for breast cancer. I'm talking about general prevention.
Yeah, general prevention.
So general prevention, primary prevention, vaccination, lifestyle changes, nutritional benefits. There is no vaccination for breast cancer. So we are limited to lifestyle changes. Keeping a healthy weight, limiting or stopping alcohol if we can, limiting tobacco use if we can, and then good nutrition. Good nutrition means getting all the vitamins and nutrients you eat. Today, in the food we eat, the source of the food, the storage of the food, the sun in which our vendors sell the food, 80% of the nutrients we go and we don't get it. Even the cooking mechanisms we use. That's why this whole vitamin therapy infusion comes to play. You are not getting the adequate nutrients you need to get from your food. So you have to find another channel or another way to get it. And this time round, we are infusing these directly into your veins, so you get 100% efficacy of the vitamin therapy infusion. So what vitamins specifically? Each cocktail has what it takes, and that is what brews where you have to go and have it. Each cocktail, we have, like I said, for the breast cancer, we have a vitamin that inhibits cell growth. We have a vitamin that promotes tissue repair. We have a vitamin that has detoxification at immune cost. So putting 3, 4, or 5 vitamins monthly, bi-monthly as a woman 35 years and above is a great deal to supporting breast cancer prevention primarily. That is primary prevention. And then we can move on to tertiary secondary prevention. That is putting measures in place for early screening, so we can detect the disease condition before signs and symptoms occur. The moment you can see very glaring signs, we are in danger. It makes management difficult. As a public health practitioner, if you come to me with a disease condition which is fully blown, we are all in trouble. You are going to suffer as a patient. I'm also going to suffer as a practitioner because we have a big deal to work with. So it is beneficial to both of us if we detect it early. And then we all save ourselves the stress. So in breast cancer, self-breast examination is a secondary prevention. Breast scans are secondary prevention, and then the gold standard, which is a mammogram, is a secondary prevention. Now, the self-breast examination, I'm sure people have heard about it all through the month, but it wouldn't hurt if we go through it again. And as much as you can, it doesn't cost anything to do self-breast examination. So just do it frequently as much as you can, so you can tell the changes early enough, and then we can remedy the situation. So for a self-breast examination, you stand naked before a mirror, put your hand by your side or by your waist, and then you do the physical or the eye examination, the eye service examination, I call it. The changes in size, in shape. If one is longer, one is shorter, one is scaly, you can do all of that by eyesight. Either your hand by your waist or by your side. Now, after that, you can put your hand up on your head like this and then see whether they are fine. And then one hand on your head. And then you create an imaginary partition of your breast into 4 quarters. The breast is large. If you want to do everything at a go, you miss some point. So with your own imaginary lens, you create the 4 quadrants. Now you start from the upper aspect of your armpit. I mentioned the armpit is inclusive with this particular discussion. Your 4 fingers, people use 3. I think it's easier for 4 for me. The flat surface of the palm. And then you start pressing the breast against the chest bone. Okay, the bone of your chest. Okay, in a circular motion, slowly with your imaginary partition that you have created. And if there are any abnormal thickens than the normal lumpiness the breast feels, you will notice it. You will know. Yes, you will know. Secondly, we have been saying that if you have a partner, encourage, intimate partner moments where the partner sucks your breast and all that. There is no scientific evidence that reduces breast cancer, but it has its own benefits. We want to keep our partners and our male counterparts part of this whole fight against breast cancer. Okay. And the more your partner gets used to that practice, he can be the changing scene person. Changes you cannot see, he possibly can see through that process. So if you have a stable partner, I don't see why you shouldn't take advantage of that benefit. 3, if you are a woman who's had a baby, these days, women of these days are too complicated. People choose not to breastfeed by themselves, okay? If you can, apart from all the beautiful benefits of breastfeeding, which I'm sure during the World Breastfeeding Week, health practitioners talk about, in the prevention of breast cancer, it limits your exposure to estrogen levels. Because when you are breastfeeding, most people have reduced estrogen levels, so they don't menstruate. If you breastfeed for 2 years, there's a probability for that 2 years. So you have taken 2 years exposure of estrogen out. So if you had your first cycle at age 15, you hit menopause at 45. We are supposed to ordinarily have a 30-year period of estrogen exposure. You've had 4 kids. Each of them you breastfed for 2 years. You have taken 8 years out. And predisposing wise, you have limited the number of years you are getting exposure to. So it is another beautiful, non-financially constraining way, financially non-constraining way to reduce the incidence of breast cancer. Did I make sense to you?
You really have made sense. But one thing is that, so I know some mothers who prefer to do get out the pump exactly, pumping it out. Is that not the same as a child feeding on the nipple?
It is supposed to be the same, because if you've done the pumping before, it uses the same suckling reflex to pull the thing out. So we are close to the same. But if there is a possibility, because of working class women, we all have done it. I mean, you can't have your baby with you at the office and you want to continue exclusive breastfeeding. So yes, it does. If you've done it before, you feel, when the pump is sucking, you feel that same effect that comes with the baby. But as much as you can, when the baby is there, do it directly, because it has its own bonding benefits, which you don't want to let go. Yes.
Right, okay, so viewers, are you sending in your questions? Because Fana is here to answer it all for you, and she has spoken quite a lot on, the preventive measures, what exactly we can do. But, the whole awareness of stopping drinking and stopping of smoking and then eating healthy and then all that. I mean, it's there. I think that people are beginning to, those who were adapting to such lifestyles are beginning to do better. But one question that I have is that in relation to breast cancer, does the size of your breast matter?
Not necessarily, but arguably, sometimes there are things that science may not support, but logical reasoning and clinical reasoning supports. When the breast is huge, it means the number of cells, in proportion size, the quantity, the volume is quite larger than somebody who has narrower breast. So the probability, if we have 5 balls, and we have only 1 red ball, it might be difficult for you to pick the red ball than having 50 balls and having, let's say, 20 red ones. You understand? So the number of cells, if we have huge number of cells any of them can start up the cancer growth.
Right.
All right, because you have a larger volume of ducts, a larger volume of connective tissues, you have a larger volume of lobules, okay? But if such person is keeping a healthy lifestyle, and you with the smallest breast, you are behaving anyhow,
just living anyhow,
you will get your breast cancer, and that person will live a stress-free life, okay? So it all boils down to being intentional about preventive health strategies. It doesn't mean automatically because you have, voluminous boobs, you are automatic. No. Science has not, brought that out hugely for defense at the moment.
What would you say has been the worst case scenario that you've dealt with in relation to breast cancer?
The communication of the diagnosis or the prognosis to the person. Yes.
Okay.
I mean, this is a lifelong disease condition, and management in this part of the world is difficult. Our health-seeking behaviors are quite bad. So most cases, you don't see it early. You see it at a point where we have to use all the vigorous means, chemotherapy, where you're having hair loss, where we have to cut off, and you know how society sees this. How is my husband going to deal with me without a breast? So that psychological part of, breaking the news and explaining the framework of treatment to the patient, to me, seems the most challenging. At
what points of the stages does kind of woman get to that level? The cutting of the breast.
No, that is the end stage.
The end stage.
Where the cancer cells are too many. So you have to cut off and then keep only the healthy parts. Even with that, we still have to do chemo to combat. When it gets to end stage, it's difficult.
Right.
It's difficult. That's why we didn't come here to discuss how to manage end stage breast cancer. It's of no benefit. Though it is possible. People are living with end stage, but as much as we can, we want to limit those negative numbers, okay? Because it's tough, like I'm saying, you struggle, we struggle as well. So as much as we can, let's keep it minimal, all right? So it makes life easier for everybody. But if you should get there, practitioners are there, support groups are there, medications are there, will support, will help to make you live life close to normality again. But as much as we can, let's keep it minimal.
We'll come to the numbers of women or men trooping in to your health facility to get checked and all that. We'll come to that. But then we have some comments. Please, is it normal for the left breast to be bigger than the right breast? I believe it is, to some extent.
It's like I'm saying, both bilateral aspects of the human body are sisters, not twins.
Not twins.
From eyebrows to lashes, everything that is true in the human body, you can see a slight change. So if that is what has been with you, usually when you come, when we are taking you through the questioning for screening, we ask you, are you like this? Yes. Is it normal for you? Okay. There are people who have health statistics that are not within the normal parameters, but it is normal for them. So clinically and disease progress wise, we are not concerned and we are not worried.
Okay. Please, I'm a female. There's hair growing around my breast duct. Is it normal?
What does she mean by her breast duct? Because duct is
inside, exactly. So
maybe it's just around the breast. Yes, if it doesn't feel or any of the signs we with the signs, we didn't say hair growth. People have hair. Yeah. There are females with lots of hair here everywhere.
Just so like you.
Yeah. That shouldn't be a problem if she's not finding any of the signs peculiar to breast cancer.
Okay.
But if she's somebody who wants to save her mind their troubles, she should just go for a check. There's nothing wrong in going for a check. It's better to go and they tell you there's nothing cooking than stay at home and there's a problem.
Right. So please go get checked. Good morning. I'm just feeling the show from Tadi. Thank you. Please, since I'm a man, what should I do to prevent breast cancer?
Everything we've spoken about. The only thing they are not, they are missing is the estrogen part, but they have alcohol dependence. On the average, men drink more than women. There can be few women who probably drink that much, but on the median. So tobacco use, alcohol use is more prevalent with the masculine figure. So I think that is something they should pay attention to. But everything we've discussed is peculiar to both men and women.
And that even brings me to adolescents who are engaging in all these acts, smoking at a very early age, drinking at a very early age. And the probability of they being exposed, you know, from that age.
Yes, you see the number of years you get exposed to anything factors. At least we've learned that this morning. So if you start too early, that is where the problem is. You're just accumulating the number of years. You are building up toxins, and you are not even using any preventive strategies to detoxify the right way. So too many things, too you know, unhealthy lifestyle happening too early is dangerous for any disease management.
Wow. Yeah. Okay, next comment. Good morning. My mom gave birth to 10 kids, but still had pageant disease of the breast. Okay. I always feel pains on my breast before menses. I have gone for examination by professionals, but they said it's normal. Oh, yes. Sometimes I do feel pain in my breast before my menstrual cycle.
Yes, that's normal. I mean, pains, the pains that we're talking about are those that are not associated to the menstrual cycle. It's normal for most women to have menstrual cycle pains. But afterwards, like I'm saying, there could be people who even feel the pain afterwards. And it's still normal to their selves. That's how they are normally. Okay, somebody comes, I have cramps. When have you had? Since day one. That is them. It is usual with them. So in such case, clinically, we don't really do anything extraordinary. Okay, we just try our best to manage the pain. All right, like everything we have discussed. It's not automatic. I've said it. Even nature, God in his own image, create human beings, and sometimes there are clauses with them. We give birth to people, we know nature produces that, and sometimes everything is perfect, and sometimes there are problems. Sometimes you put an order to your printer to print something. There is A4 sheets, there are ink, there's everything, and then the printer prints and it's a blank sheet.
Nothing,
Unforeseen circumstances happen in life. There are negative extremities to every case that we cannot tie science and evidence to. So with what she's saying, her mom could have had 10 kids, breastfeeded 3 years for each kid, reduce her estrogen exposure by 30 years, and can still get breast cancer. That is life.
Because she said the pageant's disease that she mentioned.
Exactly. But in public health, we are looking at majority, head protection. And when we talk about head protection, we are talking about 80% of the population. The 20% are outliers, and it is acceptable. Therapeutically, it is. So once we have majority of people going through that, you know, straightforward route, we can have excesses, having unusual cases, but we manage them case by case.
Okay, let's take another comment. Good morning. I'm really enjoying the topics. I'm a breastfeeding mother, and I have noticed that my left breast has become smaller than the right one, even when it's engaged. Okay,
interestingly, the two breasts, even when you are breastfeeding, the number of times how each of them gets full can differ. So it could be that one has that fullness. You might even have a baby always sucking a particular one. It's interesting. You see that the things about femininity. I have a male colleague who tells me, Fana, too much.
You're complicated.
You're complex, okay? But like I said, if it's something that will give you psychological stress, pop into a health facility. Let's make a check and tell you there's nothing cooking. You have the peace of mind. If you don't do this, this will haunt you every day. Once you get naked, you get a panic reaction. So just pop into a health facility, get a breast scan done, if you are 40 and above, get a mammogram done. Be sure there's nothing happening, and then you can put your mind to rest. Yes.
Okay, so let's see if we have some more comments. Okay, so what are some of the weirdest things you've heard about breast cancer? People coming into your health facility and tell you all these things about breast cancer?
Excuse me, I mean, this is not to get anyone, but I've met male partners who are so unsupportive. Okay. I've had a woman before who's had her breast taken off, you know. This is by no fault of anybody, you know. You know, and she's made to feel the pinch. It's difficult. I'm not a man, but I want to presume it's difficult to get up and get to know that your woman is, but it cannot be more difficult for you than for her.
Right.
So some sense of empathy should come to play when we are managing cases like that. There's a whole lot of science, but a big deal of compassion and empathy. If you have two women with the same stages of cancer, going through the same therapy, chemotherapy, surgery, and everything, you put them in two different families. One devoid of empathy, sympathy, compassion, and support. One will leave this world earlier than the other. The person who will thrive is the one with family support, family compassion, sympathy, and the fact that they want to embrace her as who or she is. Now prostheses are in. They have that breast, so outwardly they can present the way you are. The best you can do as a partner is to hold the person to let the person know that she has company on that journey of difficulty. So for me, that's the most heartbreaking thought, because as for the disease condition, once you come to the hospital, we will struggle with it as much as we can, but we need that mental fortitude that comes together with clinical management for us to achieve success. We need it from the people around the patient to make treatment efficacious.
Wow.
Yeah.
Okay. Let's take some more comments. A friend took an abortion pill for less than a month pregnancy and complained of seeing breast milk when she squeezes it. Is it normal? Oh, wow.
Interesting cases up and down. Like I said, if it was just once in a while, emergency contraceptives are supposed to be taken, that should not be the normal pattern of it, okay? Because less than a month pregnancy, the system has not chunked to the level where there's milk production. So that can be a different issue on its own, not associated to the pregnancy at all. So that person needs to get checked. That person needs to get checked.
Your friend has to go get checked. Advise her to do so. Next comment. Good morning once again. Please, I want to ask, how can late childbearing lead to breast cancer? I'm focused from Tardy. Well, late childbearing, like I'm saying, so far there is no clinical evidence to support that. Late childbearing, I can't pinpoint a reason how it can. There could be other factors initiating the breast cancer if there's somebody who's had a child late getting breast cancer, but not necessarily that variable of having a child late contributing to the breast cancer. Next comment. Good morning, please. It is normal to have one breast a bit larger than the other, or is it is it normal? Yes, we actually have this question. Addressed it. Do we have some more comments? So thank you for your messages, thank you for your questions, and I hope that Fana has answered all your questions for you, and I hope that after all this education, the slightest difference you see in your breasts, you will quickly go to a health facility and get checked. And so, Fana, before you go, what do you want to? What do you have for viewers?
Glades Medical Center. We are located at 7 Golden Glades Street at Chadu Runabout. Our numbers are 0540 552686. If you want to come around for infusion therapy, just put a call through and we'll take you into detail, the components of it, and then the benefits they do have for you. I'll be happy to have you around.
I was going to ask you, so any age at all, you know?
Sure, any age at all. Once you are 18 years and above, there are many different types, and then you have a feel of it, and I'm sure you'll be able to testify positively.
I can't wait. Fana, thank you so much for your time, and thank you for the education on the benefits of preventive strategies of breast cancer. It's still the Breast Cancer Awareness Month. If you haven't gotten checked, please go to a health facility and do so. And before you do that, I mean, like Fana mentioned, you can do the self-breast examination. So how she demonstrated how you do it, just do exactly that. If you see anything unusual, you quickly go to a health facility and get checked. My guest for this conversation has been Stephana, also known as Fana, Sefa Boateng, public health practitioner, women's health education educator, executive director at Glades Medical Center. Fana, thank you once more.
You're welcome. Thanks for having me.